Hi, my name is dkremus, and this is my presentation on cerebral palsy for Kin 583 for Westchester University. Please follow along with my PowerPoint presentation as I present this information with you today. The objectives that I will hopefully accomplish through my presentation are the definition of cerebral palsy, how cerebral palsy is diagnosed, the clinical characteristics of the various forms of cerebral palsy, the sensory, cognitive, and medical problems associated with cerebral palsy, the range of management options for cerebral palsy, and then lastly, we'll discuss some teaching strategies and activities for children with cerebral palsy. Okay, so if you're following along with my PowerPoint, we're going to be starting on slide number 4 with what is cerebral palsy, or CP for short. CP is a group of chronic childhood motor impairment disorders that are defined by specific functional characteristics such as limitations in mobility and hand use with signs of neurological dysfunction, and also impaired movement control and posture. Some non-motor impairments are sensation, cognition, communication, and behavior impairments. And finally, some medical conditions like strabismus and epilepsy are also some functional characteristics for cerebral palsy. Okay, on slide 5, we'll discuss the clinical features of cerebral palsy. The clinical features are the result of a developmental disturbance that occurred early in brain development and caused a brain malfunction or some form of injury. This usually occurs during fetal development, or during the perinatal period, or during the first year of life. There are many underlying factors that may lead to the development of cerebral palsy in a child. These factors can include a premature birth, a low birth weight, a multiple birth pregnancy, and the issues that are associated with that, an infection or inflammation in the womb, a condition called hypoxia, ischemia, encephalopathy, or HIE for short. And this is a condition in which the brain doesn't receive enough oxygen, and some other genetic factors. Cerebral palsy is considered a static insult, but its functional manifestations can progress in several different ways. For example, let's say we have a child that's born with hyponia associated with birth asphyxia, and they may develop spasticity or dystonia years later on. This is going to be the result of a maladaptive plasticity or faulty brain wire. And we'll get into, I'll explain some of these terms later on in the presentation here. An adult with dyskinetic form of cerebral palsy is prone to develop secondary spinal cord compressions from long-term repeated head and cervical spine movements, which would cause progressive weakness and a decrease in functioning. And finally, there may be progressive orthopedic deformities secondary to spasticity, chronic muscle shortening, and joint dislocations. And again, don't worry, there are a lot of big terms here. I'll go through and explain these as we go through the different slides here. All right, next let's discuss the causes of cerebral palsy. The underlying factors disrupt the development of neuronal networks in the cortical and subcortical pathways that control movements. And a key idea in understanding the cause of cerebral palsy is what's called selective vulnerability. This is the susceptibility of specific regions and cells to injury during a specific time period in brain development. Between 24 to 34 weeks of gestation, immature white matter cells that wrap myelin around axons are open to injury. This is different from full-term infants, where the susceptibility is in deep gray matter neurons in the basal ganglia and thalamus. In children born preterm with spastic forms of CP, the periventricular white matter injury is linked to white matter cell injury. In full-term infants with asphyxia or kernicterus, the injury in the deep gray matter structures is linked with dyskinetic forms of cerebral palsy. The recognition of selective vulnerability has led to new treatment approaches in the NICU for these premature births. Here they use, or they're starting to use, hypothermia, in which it is used to ameliorate brain injury in full-term infants, with asphyxia, which is, we describe that as, it's a decrease in blood flow and oxygen during birth. And they're having some success with that new technique. A misconception of cerebral palsy is that most cases are the result of birth asphyxia, when in fact only about 10 to 20% are caused by this problem. And there's a lot of other issues there. Establishing the etiology or the cause is very important for designing a treatment program, understanding the prognosis, and for anticipating the recurrent risks in future children. Information from the child's medical history and physical exams are key to determining this cause. An example of this would be knowing a child was a preemie and has signs of spastic diplegia, which would strongly suggest an injury to the cerebral white matter. Brain imaging is also helpful in finding causes here, and a technique called brain anatomic MRI is considered the best tool for doing this. Statistics are showing that 70 to 90% of children with CP will have significant diagnostic findings with neural imagery. So there's a lot of success here in finding the cause. Okay, so again, if you're following along with my PowerPoint, we're now moving on to slide 7. In the developed world, only 2 in 1,000 children will suffer from cerebral palsy. This is going to be associated with prematurity and low birth weight. Of the 50,000 very low birth weight babies, less than 3.5 pounds, born in the United States each year, only 10 to 15% will develop spastic cerebral palsy, and 20 to 50% will develop disorders of a higher cognitive functioning. The incidence of CP increases as the gestation period decreases. Up to 20% of babies born before 28 weeks gestation will develop some form of cerebral palsy. Surprising fact to me is that in the past 20 to 30 years, this incidence rate has not changed. I found that pretty surprising with all the medical advances that were out there. Okay, now let's discuss some of the risk factors. So here we're on slide 8. There are many risk factors that will increase a child's risk of developing cerebral palsy. Both indirect, which is mother to fetus, and direct infections of the fetus or newborn are associated with some form of cerebral palsy. This can also occur through a virus like rubella, bacterial meningitis, chorioamnitis, or a placental infection. If the mother would contract an infection and have a fever, the fetus would be at an increased risk for cerebral palsy. So there's one that would come from the mother. As stated previously, premature birth is the greatest risk factor for developing cerebral palsy. Premature infants born before 28 to 38 weeks and weigh less than 3.5 pounds represent almost 1/2 of all cases of cerebral palsy. There's an increased risk associated with complex interrelations between the destructive and the developmental mechanisms of the brain also. The most common brain injuries that lead to CP are what's called periventricular leukomalacia, or PVL for short, and intraventricular hemorrhage, or IVH. When a full-term infant develops cerebral palsy, it can be linked to birth asphyxia, which we discussed earlier, where damage is done to the basal ganglia, congenital brain malformations, coagulation abnormalities, multiple birth pregnancy issues, or an intrauterine infection. These children are usually small for their gestational age and have some issues with the central nervous system.